This year marks the 10th anniversary of Covenant Health. As we celebrate, we take the opportunity to reflect on what we've accomplished over the past decade in working together to make life better for Albertans. Our anniversary theme, Many Voices, One Mission, Stronger Together, reminds us why we came together, to forge a bold new vision, to build on the strengths of each member of our family, and speak with one strong, unified voice across Alberta for those we serve. Our vision calls us to be leaders and partners in transforming the health system and creating communities of health and healing. At the heart of this effort is our mission, to serve people with compassion, body, mind, and soul. This is what drives us. This is what defines us. Reflecting over the past 10 years, we're grateful for this opportunity to serve and proud of what our team has accomplished. We recognize the growing need for senior services in Alberta and the government's need for sustainability and responsive models for serving seniors in their communities. We launched Covenant Care in 2013, and the organization has grown to serve over 1,000 seniors each day across the province. Since 2008, we've increased our continuing care capacity by 70%. We've been at the forefront of innovation in dementia care, serving those with complex mental health needs, opening Villa Caritas in 2009 to provide specialized geriatric mental health services for Northern Alberta. We have created centers of excellence in seniors care and palliative care, and have worked across the province and in fact the country to explore major shifts in approaches to raise our voice for quality palliative care for all. Building on our strength and shared resources, we've advanced quality of care and been good stewards of our resources, consistently meeting or exceeding standards and service agreements. The rural communities we serve have joined with us to create change, for aging couples who want to stay together, for youth struggling with mental health issues, and from those recovering from stroke. Together we've navigated an ever-changing healthcare landscape, responding with compassion and integrity to growing demands and emerging issues. We've learned that we are truly stronger together. Today our programs have significant footprint across the province that extends across the continuum of care from birth to end of life in our urban and our rural hospitals, health centers, continuing care facilities. In 2018, we celebrate another year of growth and accomplishment in serving Albertans from north to south, from birth to final years. We achieved baby-friendly designation from the World Health Organization in Bonnyville and in Edmonton. We began construction of seniors care facility in Killam and the new Misericordia Emergency Department. We opened a complex mental health unit in Lethbridge and a new 250-bed facility in Calgary. This is a testament to the more than 16,000 dedicated staff, physicians, and volunteers who propel us forward, driven by their own calling to serve and our vision to be transformative partners in healthcare system serving Albertans. Thank you to our communities and our partners for your support on this journey. Thank you to our patients and residents and families. We walk with you each day. It is our immense privilege to serve.
The Covenant family builds on a 155-year legacy of our founding congregations of sisters. These courageous women laid the foundation of Alberta's healthcare system, responding to the everyday needs of communities and the unmet needs of the sick and dying, caring for the whole person, body, mind, and soul. This rich legacy is not left for the history books, but is something that I personally experienced. As a child, I found myself in hospital in Mundare under the care of the sister servants of Mary Immaculate. I was in a hospital for several months. Up until that time, I didn't speak a word of English because we spoke Ukrainian on our family farm. But that didn't stop the sisters. They took it upon themselves to teach me to read, speak English, and to do math. I will forever remember what the sisters did. They saw me as more than a patient. They saw me as a whole person, a child who needed love and support, and a student who needed to learn and grow. The relationship we shared was transformative and healing. It gave me hope, and it made me whole, body, mind, and soul. This is the essence of Catholic healthcare. It is a story of faith, courage, compassion, and astute leadership. I know that mine is just one of many stories of lives that have been impacted by the care and compassion of staff, physicians and volunteers in each of our facilities every day. I speak to you today as the chair of the board of directors of Covenant Health. But as the sisters taught us, we are each more than our titles. I'm a man who cares deeply about the values that are at the heart of the sisters' work. I am also a former elected official who knows firsthand that provincial governments cannot do it all. Governments desperately need quality partners who work with humility and ingenuity in an integrated way to address health needs. I'm a rural Albertan who loves the land and knows the importance of having strong and healthy communities across Alberta. I'm a volunteer who believes in the power of collaboration and community. I am a baby boomer who is getting older and appreciates the need to ensure Alberta seniors have the care they need to age with dignity and connection. I am a husband, father, and grandfather who wants my children and their children to be able to live in a healthy society and access compassionate, quality care when they need it. As stewards of the sisters' legacy, we recognize that we are all wondrously made as whole beings, body, mind, and soul. In this world where healthcare is big business, driven by new technological advance every day, this is so critical. Like the sisters, we strive to be resourceful and astute leaders, problem solvers and prophets, whether courageously speaking up for justice or quietly and purposefully gathering the resources and support needed in help of those in our care. The sisters had a courageous spirit and were not afraid to risk. Most of all, they focused on their values and expertly navigating public policy, powerful forces, and ethical conundrums. The sisters always asked, "Is this the right thing to do?" A question we continue to ask as we strive to honor their mission in our work. This year, Covenant is celebrating 10 years of service to Albertans. In 2008, 12 organizations joined together around shared vision and values. Our ability to collaboratively to improve the care we provide to patients and their families shows that we are indeed stronger together. The last decade has been an exciting chapter in the legacy of Catholic healthcare in Alberta. We have learned that our strength lies in the unwavering commitment to the mission and enduring values that unite us in our dedication to patients, clients, and their families. Our team is diverse and strong and dedicated to improving the quality of life of Albertans. I'm exceptionally proud of the staff who commit themselves daily to this important work. Thank you to those who have journeyed with us over the past decade. We are honored to have shared moments with you, walking with our patients, residents, and their families as they face challenges and changes that have profound impact on their lives. God bless you.